Yep, I've done that.
Okay, there you are.
Welcome, everyone. Today we have Max and Dr. Barney with us. Dr. Barney has been a medical advisor for SolarWave for 30 years. Dr. Paul Barney completed a Bachelor of Science degree in zoology at Brigham Young University and received his medical degree from the University of Utah. Since completing his internship and residency in family practice in 1982, Dr. Barney has been in primary care family practice and emergency room medicine. He is also a licensed acupuncturist and a respected authority on natural and alternative medicine. He has lectured extensively on natural medicine and is the author of several books on the subject, including Clinical Applications of Herbal Medicine and Doctor's Guide to Natural Medicine. Welcome, Max and Dr. Barney.
Thank you.
Thank you, Jennifer. It's really a privilege to have Dr. Barney with us on this training. Dr. Barney, are you at your wound care practice today near the Davis Hospital, or where are you calling from?
Yep, that is where I am.
Wonderful. The first question I have is, why do you wear your watch backwards? Is that to protect the screen from scratches?
It is. When I was in high school, I started wearing it under my wrist, partly to protect it against walking along hallways and getting it scratched.
Ladies and gentlemen, if you learn nothing else today, this is the first tip from Dr. Barney that could save you money and agony. So I'm glad we got that out of the way. But it's been my privilege to work with Dr. Barney closely for, I would say, 19 years. When I joined the company 20 years ago, Dr. Barney and James Solander were my mentors. Having entered the nutritional space as a newbie, I would sit with them, I would go on herb walks with them, and I would just learn from them. And it's been a wonderful journey, and we're privileged to still have them with us here to continue consulting us. So we'll get into it. We had about 20 questions submitted. I went through all of them, and I funneled them down to 14 questions. 7 of them Dr. Barney is going to answer. 7 of them I'll take on, and with his help, we'll get through these. We also have Rachel on the line in case if she needs to look up something to fact-check me, so to make sure I'm not going off course. So let's get to the first slide, and I'll go ahead and advance. And this is from Dominic Hart in Colorado. The first question is, Dr. Barney, being a physician, what initially drew you to holistic medicine?
Well, I was drawn, I did a little bit when I was in residency, but when I was in Cedar City, my first place of practice, I was there for 5 years, and after about 3 years, I started accumulating a group of people who I had done everything I knew what to do. I'd sent them to specialists up in Provo and Salt Lake, and they've often would come back and say, gee, the specialist has very little to add as far as, future treatment, and that was very frustrating. And at the time, I was becoming interested in acupuncture, and the reason is to offer people another treatment that they had never had before that may be helpful to them. So that was my first sort of foray into alternative medicine and the reason for doing it.
And so it was acupuncture, and this was what year?
That was back in 1987, 88.
Were there many others in Utah using acupuncture, or were you kind of early in that?
Well, I was one of the first 3, and it wasn't until 1991 that I actually was able to go to UCLA or down in California to a course that was sponsored by UCLA and be trained in acupuncture. And at that time, there was only 2 other physicians that had been trained and through that same program in Utah. So I was one of the first.
Let me tell you guys, I remember coming into Nutraceutical, and there was a pretty heavy-set gentleman who worked in our marketing department who had a ton of pain in his toe. And I didn't know if it was gout. I don't think it was, but he had something, and he could barely walk. And I remember Dr. Barney pulling out his needles and poking him, and it wasn't just in his foot. I thought it was in other areas, but the pain went away almost immediately. And that was my early recollection of Dr. Barney with acupuncture and how it helped him with his pain. And I became a quick believer at that point. Dr. Barney, tell us what this image is on your slide for those that are on the webinar portion.
Yes, this is Immortal, I-N, not I-M-M, but I-N Mortal. It's a member of the milkweed family. It grows in the hills above me and is very useful for heart conditions and for lung conditions. Michael Moore said he would rather use this than almost any other herb for serious lung conditions. So it becomes, to me right now, important with COVID going around as something that people may be able to use if they become infected and start having some lung issues.
That's amazing. The close-up looks a little bit like the pelargonium, which is also used for lung conditions, just that kind of color and shape. But that's really pretty. Tell us a little bit before we go on, because we put on some images of these different herbs. Where did you take these, and who were you with?
Well, these, I think I was just by myself. Now, this was in preparation, partly at least in preparation for that herb walk that you had mentioned earlier. And I wanted to get some pictures of herbs earlier in the spring when the blossoms were out, and then a little bit later when they were going to seed or had changed, so that when we went on our herb walk, I could show pictures of how plants used to look earlier in the season. But a lot of these I just took on my own during my hikes in preparation for that herb walk.
Wonderful. Okay, let's go to the second question. This is by Dave Whelan in Utah, who's actually traveling to Nashville, so he wanted us to record this so he could hear the answer. So Dave asked, which, if any, natural product do allopathic physicians now consider as acceptable treatment options?
All right, first, the image on the left is that same immortal plant after it's gone to seed, and you can see that there's little puffs of what look like cotton, which is what you see from regular milkweed plants. So that was the purpose of having there. The one on the right is salsify, that looks like a very large dandelion, and later on we're going to see some pictures of the blossom, but the root is edible. But it's better in the spring when it's not quite so woody. Anyway, allopathic physicians still physicians using supplements, herbs. You know, the main thing is still vitamins and minerals that are used. They're becoming more accepting, and one of the things that I see because of my specialty right now in treating wounds, and some of the common wounds are venous stasis wounds, wounds that come on the legs because veins are not working well. And horse chestnut seed is very useful, and I see a number of people now coming into the office already on horse chestnut seed from physicians in the community. So that's one of the ones that I am aware of, and we can talk a little bit about COVID right now, because that is another area where recommendations are being made from medical schools around. And these are the recommendations. If you're at home and you want to prevent an infection with COVID, then vitamin C 500 milligrams twice a day, and quercetin 250 to 500 twice a day, zinc 75 to 100 milligrams a day, and melatonin up to 2 milligrams at night, and D3 1,000 to 4,000 units a day. Now, if you get symptomatic, the only thing that changes in those recommendations is increase the amount of melatonin at night up to 6 to 12 milligrams. So I found that very interesting, is that the people at Eastern Virginia Medical School, this is what they're treating people with prophylactically and what they're recommending or they treat them with once they come into the hospital also. And then they start adding antivirals and other things. So it's interesting to me that those are the recommendations, and they're all supplements that they're recommending right off. Now, there are no herbs among those, but they are products that we use and you make. So those are the main things. Now, CoQ10 is used by a lot of physicians. Things like astaxanthin, because of its help with eye diseases, that's becoming more commonly prescribed.
Okay, that's
I may
great.
think of other things as we go along, but those are the ones right now.
Yeah. You've mentioned zinc many times, vitamin D, and all of these, but that's really relevant now to hear what you're recommending or hearing about COVID. And I think a lot of us have read the vitamin D, the C, the zinc, but I didn't know about melatonin, so that's very informative. Are you worried about any side effects with people taking that level of melatonin, or I mean, we've seen some shows, yeah.
Just a side note, my 3-year-old granddaughter, who's a twin, she got into the melatonin that her mother uses actually for her on occasion and took upwards of 20 gummies, called Poison Control and said, hey, don't worry about it. Okay, it'll be gone in 3 hours, and you don't have to worry about anything. Now, she didn't even get tired. And had no untoward effects. Melatonin is pretty safe at a variety of concentrations and doses.
Okay. Dr. Barney, before we move on, there's several questions on the chat box. Can you just repeat the protocol for COVID that you mentioned from the University of Virginia?
Well, I can, or if you want to get it and send it out, either way. But first of all, let me just say that they're finding that vitamin C and quercetin working together work much better than either one alone in fighting a variety of viruses. And in fact, in some early studies using quercetin, they found that quercetin twice a day had a much more significant effect than quercetin once a day. And so quercetin's effect probably doesn't come through the immune system. It probably comes through a direct toxic effect or interaction with the virus. So it's vitamin C 500 twice a day, quercetin 250 or 500 twice a day, zinc 75 to 100 milligrams a day, and then the melatonin before hospitalizations or before you get sick, it was 0.3 to 2 milligrams at night, vitamin D3 1,000 to 4,000 units a day. And as I said, if you get sick, the only thing that changes out of that recommendation is having melatonin up to 6 to 12 milligrams at night. And then even when people are admitted to the hospital, the only thing that really changes is they start adding medications to help stop blood clots and to treat symptoms. So,
excellent. Okay, great. And just a reminder, this is being recorded for everybody, so if you didn't get that, we can share the recording later and you can hear it again. But that's wonderful. Okay, let's go to the next question. Again, this is from Dave Whelan. He had a lot of questions, so I broke them up a little bit. Is there recent high-quality research on any natural product ingredient or ingredients that excite you?
Well, there was a couple that over the course of this last year sort of stuck out. Some are good and some are not so good. One of them was that taking EGCG can improve the function of several antibiotics used to treat Pseudomonas. Now, that's a difficult problem, Pseudomonas infections, and it's becoming antibiotic resistant to most antibiotics used against it. So to find something that will increase the effectiveness is significant. So there's EGCG and actually selenium. Both increase the effectiveness of antibiotics against Pseudomonas.
That's exciting.
Well, the other ranges, it really is around the microbiome and the research being done there. And again, sort of the good and the bad, because there are many prescriptions, from antibiotics to antidepressants, that alter the microbiome and therefore potentially can lead to chronic health conditions. And the problem is that we don't know necessarily what they're going to alter when we first start taking them, and there's not enough research now to know exactly in what way they do alter the microbiome, and therefore we don't know what we can do to treat the problem. Now, the other part of that that's good is that the research is going forward, and we're finding many conditions that are either caused by a dysfunctional microbiota or that is helped by being able to alter the microbiome in some way. To me, the difficulty is that it's not always, in fact, it's almost never the same bacteria that is affected or that you can affect to come out with a good result. So we don't know necessarily which bacteria is going to cause the best result, and we're not sure how to get it into the system and keep it there, as opposed to taking it daily. So one thing that I was just going to mention is that taking things that can have a positive influence on the microbiome, such as berberine or glutamine, may do as much as trying to alter the microbiome in very specific ways. Or taking those two things can make sure that when we do alter it, that it stays altered, either permanently or for a longer period of time. So, the research around the microbiome really excites me.
That's great. And we'll talk a little bit more about microbiome, because it has been such a fascinating field that you and I have been discussing. Another question Dave had is simply, what supplements do you take on a daily basis?
Well, I've already actually mentioned them. I take N-acetylcysteine, CoQ10, astaxanthin, ginkgo, Urocalm, and melatonin regularly, but not necessarily nightly, and berberine. Now, those are the ones I take regularly. Now, I've added all of the others that we talked about for COVID, including sambuactin that I hadn't mentioned, but that's something I take. And I do take the Immortal. I did harvest those roots. I do create a powder out of them, put them in capsules, and I do take that sort of as a strengthening for my lungs, just in case I were to get it, and then I'm going to increase the dose should I happen to get it. I also take astragalus. Now trying to make sure that I'm preventative.
That's awesome. Yeah. I'm just thinking, how do I find Immortal now and get it into solar rays? So we might have to grow some in your backyard there. But
we may have to, because I've looked online. It doesn't pop up easily.
No, exactly. I'll have to research that one. But thank you for what is this a picture of the salsify that's in blossom?
That is. This is one of the blossoms of salsify, and there's going to be another one coming up that's yellow. It surprised me the variety of blossoms that come from that one plant, but very pretty blossom.
All right. Let's go to the next question. Back to Dominic in Colorado. He said, I love the Doctor's Guide to Natural Medicine and sold a lot of them when they became available. What inspired you to write and create this?
Well, two things. One is to make things, I would hope, a little more clear in some areas that I didn't think were maybe clear enough. The other one was to take things that I really believed in allopathic medicine, and explain them in such a way that people say, hey, I can hold on to some of my allopathic treatments, and I can add to certain alternative treatments that can supplement each other, that they're not going to be counterproductive in doing both at the same time. And also, hopefully, that some physicians out there would get a hold of it and read it, which I have had some feedback from physicians to give them an understanding of how they could use alternative medicine supplements along with what they're doing in allopathic medicine.
I don't know if I've mentioned this to you, Dr. Barney, but I thought this the whole time that we've worked together, how familiar you are to me because you remind me of my father. And I've shared with him that reference, and he has used it. He used to call me a lot more often with questions until he got the copy of the book, and he references it in his own practice. And he's a big believer in natural medicine. And the problem, though, is the doctors, at least allopathic doctors, from what he's told me, don't have that malpractice protection in case if he were to recommend something natural and if somebody got sick. Of course, there's no recourse from drug companies and, lawyers there. So a lot of allopathic doctors proceed very cautiously because of their worry that somebody, whether it's caused by the herb, which is not likely or not, if they go to the doctor with complaints that, they did what the doctor recommended and it wasn't the standard treatment, then the doctor really, he could get sued and he wouldn't have any protection. Does that ever cross your mind, or are you in a different world?
Well, it really hasn't crossed my mind. The fact is that you're no more likely to get sued, and maybe even less likely, because people who use herbs, who treat people with alternative medicines are often, they talk to their patients more, they get in depth, they develop a better rapport with their patients. And so I think overall you're less likely to get sued. The fact is that if you do get sued, and it may be the fact that you used a prescription and you recommended a herb, that some attorneys, if you got sued, would focus in on that and say, what's your evidence that made you use this herb or recommend it? But I think overall, if you looked around the country, the chances of getting sued are small, and the outcomes are rarely affected by use of supplements.
Well, maybe you need to take my dad fishing and have this discussion because he's not listening to me. But nevertheless, he's a big believer, and he's always taught me that all drugs started from nature, and they just became the synthetic, patented, man-altered version of what Mother Nature provides. Like when you and I have gone on herb walks and we've talked about coumarin or warfarin that's present in yellow sweet clover, that's where blood thinners come from. So why not go back to nature? What's this picture here that's next to you? This
is a fun one. Yeah, it's death camas, very poisonous. And as wild onion and death camas grow side by side through all of the area that I go hiking in. And early on, sometimes you can tell a difference because wild onion has more of a white blossom. These are more purple. After the blossoms have fallen off, though, you can't tell a difference in the plant that's left. And the only way is to dig up the little bulb, and the bulbs look almost identical. So the only way you can tell is by smelling it, and one will smell just like onion, the other smells like dirt. So this is one you have to be careful, but it's sort of fun to watch them grow side by side and know that there is a way of telling the difference.
We've dug these up together, and so just to be clear, the onion smells like onion, and the death camas does not smell like onion, but it has these beautiful purple flowers. So kind of deceitful. You would think, let's eat the one that doesn't smell that way, or the one that looks even more beautiful, but then what would it cause? Liver toxicity?
No, I think it's actually more of a direct effect just on, well, it has some effect on liver. Yes, but it is just plain toxic. I mean, it just can kill pretty quickly, sort of like water hemlock.
Okay. Let's move on. This is Janet Little in beautiful San Diego. I read somewhere that San Diego is saying, come visit us. We don't have problems with COVID. Everything's open. I don't know if that's true or not, but so Janet, hope you're doing well. This is the question from Janet, Dr. Barney. For men and women on high blood pressure medication, let me start over. For men and women on high blood pressure medication, yet want energy, including sexual, which herbs can they use and which should they avoid?
Well, the general answer on avoiding herbs are any herb that's used for weight loss. That's sort of a general recommendation. Now, I know there are some that you could use, but for instance, bitter orange has synephrine in it, which is a very strong vasoconstrictor and can elevate blood pressure pretty quickly, depending on the dose that you take. Now, there are some that are that come from natural products, but are really refined down to a particular, chemical. Peracetam, I'm not even sure some of these. Anaracetam. Anyway, I've looked some of those up, and there's some companies that sell those, and they have a very significant arterial effect also. Now, anything that contains ephedra, mahung, brigham tea, anything that would be considered a stimulant. Now, what then does that leave us with as far as improving someone's energy level? And I think anything that's considered an adaptogen would be a place to start. And they take a bit longer to make a difference. They certainly are effective and helpful in a variety of situations. So that would include ashwagandha and rhodiola and maca and pretty much any other adaptogen. I think American ginseng would be fine. And I think low-dose licorice root would be fine. And all of those over time can increase both sexual energy and overall general health and general energy. Now, one thing, let me think, I didn't write it down. See, that's, help me out.
While you're thinking,
for sexual health, for men especially.
Mm-hmm. What's this image that you have growing by the river?
Well, this is the thimbleberry. And it just so happens that my grandkids were here from Denver last week, and I took them on a hike up there, and the thimbleberries are just coming out now, and they look a lot like a raspberry and are sweeter than a raspberry, and I couldn't pull my grandkids away from these stands of thimbleberry once we got up there. They really taste good.
Great. Let's move on. Now we had a lot of questions from the inside sales team. One of them is, Dr. Barney, do you still recommend strontium? Are there any new studies stating adverse side effects of strontium? Customers are now reporting. Oh, go ahead.
Yeah, no, go ahead. I haven't seen any new studies that concern me about the use of strontium in the doses that you have in your products. Still very helpful in strengthening bones, repairing bones, and I think you add that, and we're going to maybe talk about K2 a little later, but there are several things you could take at the same time. But strontium doesn't bother me. I think periodically when somebody is just getting into supplements, they look at strontium and they run across articles on radioactive strontium, and that concerns them. This doesn't contain any, obviously, radioactivity, and I don't know of any that have been on the market for a long, long time that contained any radioactivity. I've not heard of side effects from customers, and usually when things come into nutraceutical where people have a complaint, I usually hear about those so that I can go over what they're complaining about and look at the product they use, and I've not had one on strontium ever. So I'm actually unaware of anything.
And obviously we sell strontium as a straight mineral. We sell it in combination with calcium, magnesium. We also use it to combine it with vitamin C when we make our Reacti-C. And I think it's Dustin in our laboratory did his thesis on strontium. And so we have a patent on that reaction that we sell in React-to-C and how it slowly releases vitamin C to the body over a 24-hour period of time. So, yeah, we're grateful for this great mineral, and we'll continue to promote it.
Yeah, go back to that last one. We'll go back to that last one.
Oh, yeah. Tell us about this plant.
Well, this is one of my favorite plants, elderberry. I actually purchased some of these plants, put them in my yard, and my wife and I, after we harvest them, we make elderberry jelly, 40 pints a year, sort of my favorite condiment for toast. And it grows almost everywhere in the mountains around here. All right, that's it.
And I can witness, I've had your elderberry jelly, you brought it to me, and it is absolutely delicious. We love elderberry at Nutraceutical, that's for sure. Quercetin. This
is another blossom from Salsify. So we saw the purple one,
okay.
now this one.
It looks like the purple one. This is just yellow.
Yes. Yep.
Yeah.
Now, we've talked a lot about quercetin, and I just wanted to make sure that at least as far as treating viral infections twice a day seems to be more effective. Early on in research, when they were treating Russia-treated soldiers, U.S. treated a variety of people, and they found the same thing. As long as you took quercetin twice a day, it was effective. When you took it once a day, it lost a lot of its effectiveness. And so the thought is it doesn't work through the immune system directly. It works as sort of it has a minimum concentration that is effective, and it must have more of a toxic effect directly on the virus than working through the immune system. Now, all of the bioflavonoids work and strengthen the immune system, but quercetin specifically, and in combination with vitamin C, because it's more effective, has some direct effect on the virus. Now, deactivated quercetin, you and I talked about this. I looked it up. I don't think there's anything to activated quercetin right now. I don't see that as a benefit.
Yeah, it's not like they manipulated quercetin to make it activated. They just combined it with other bioflavonoids to try to give it a synergistic effect. But we know quercetin on its own does plenty well. What about these old wives' tales? I've heard, I don't know if it was Chris Killam, the medicine hunter, he did a big article on Fox Health on quercetin as the new secret to the French paradox. But people like cutting onions and leaving them next to their bedside and how it absorbs viruses. We know there's a lot of quercetin in onion. There's a lot of quercetin in orange, just under the peel, kind of that yellow bitter part of the orange is very rich in quercetin. Have you heard of these wives' tales of cutting onions and seeing if they'll absorb viruses from the air?
I haven't. And like, the only way they could absorb, I just don't think they attract them from the air. If they happen to land on them, they may bind them. But, yeah, I've not heard that. So, and I'm glad I haven't.
Yeah.
So.
Okay. Let's move on. Now back, so this is the K2 question. What are the current recommendations on dosing with K2? Some customers have been asking for much higher dosages. Is there a risk in taking too much?
Well, there does not seem to be a risk in taking too much. They've done some studies with K2 up to 45 milligrams, so not micrograms, but 45 milligrams, and had no change in the clotting cascade. So it doesn't force the blood to clot at high doses. The question is, in this instance, is there sort of a maximally effective dose? And is there a benefit to go above that? Now, ever since I've been involved in alternative medicine and supplements in particular, the thought is that a more concentrated form of anything is better, and a higher dose of almost anything is better. And that certainly isn't true. As I looked into it early on, and it's been some time since I really looked into it, but as I looked into it, it's always brought up that the medicine man in South America, Indian medicine men, whoever it is, they use a fairly dilute solution of everything. Now they can concentrate it by boiling it, but theirs is fairly dilute, and they have very good results. And so sometimes I think that we, because of our society, look at more is better, and it isn't necessarily. And in fact, I think it rarely is that much better. Now, for instance, vitamin C, 50 milligrams a day, 100 keeps you pretty healthy. It does increase to 500 twice a day if you're treating a virus, and there's some research that shows that 3 grams IV can maybe help things like Lyme's disease. So there are instances where going higher is better, but those are specific instances and for a specific period of time, and not to be taken over a long time of that same dose. So I think that the doses that you have are adequate, and that they're going to make a difference where they're intended to make a difference, and I don't see going higher as being a big advantage.
Yeah, whenever we would have a vendor come in with new raw material, I would always kind of schedule those appointments with Dr. Barney's visits. And I remember a long time ago when we started receiving those K2 supplier visits, the early research showed 50 micrograms. It was like 45 specifically, but let's just round up to 50. 50 micrograms was where they were looking at for bone health, and then over 100 micrograms, up to 150 micrograms is where they were looking at for cardiovascular benefit, to really try to help clear out the arteries of some of that calcium. And so we have it in Solaray at 50 micrograms, and then we have the triple strength K2 at 150 for that purpose. So those were the recommended dosages that we saw from the suppliers and the research that they performed. But there is a synthetic version of K2 called MK4, and there's a natural version of K2 called MK7, which we use in Cal and Solaray. And the dosages on the synthetic version are much higher because the half-life is much shorter. So if you use the natural version, you don't have to use as much on the K2 than you would if you were taking the synthetic MK4. So,
well, and as you and I were...
Yeah.
Go ahead.
Oh, no, I was just going to mention we have another herb here. It looks like an upside-down umbrella. What is this?
Yeah, well, first, as you and I were talking, almost all of the potential side effects and toxicity from vitamin K comes with the synthetic versions and not with any of the natural version or natural supplements. This is miner's lettuce. It's called a clasping leaf because it completely surrounds the stem. Very edible. You just can pick that up or pick it off as you walk along, and it tastes, my grandson said, well, it sort of tastes like now I can't even think of what it tastes like. Anyway, it's very sweet, and you can put it in a salad, and if you took dandelion leaf and added with it, you could make a great salad. But that's miner's lettuce. Or lettuce. And he said it tastes like lettuce, other lettuce. That's what threw me.
Okay. Great. Let's move on. I'm going to take a few of these questions, but I'll ask Dr. Barney for some help. And if anybody else has inputs or thoughts, you can always unmute your line, dialing *7. Will there be any new formulations from the microbiome, leaf therapeutics, fermented mushroom line, maybe focusing on brain function, depression, anxiety, and or mood? Thank you, Andy White in LA. Yes, the innovation team is looking closely at microbiome. We're looking at a concept called metabiotics, which is kind of the next thinking with probiotics, prebiotics, and parabiotics or postbiotics, where we look at kind of a bigger picture of the whole microbiome. And we're looking at more therapeutic formulations. Rachel and I are starting to meet with different vendors that have different clinicals that are coming out on specific strains. So we will be looking at condition-specific probiotics. With leaf therapeutics, we're going to slow down a little bit. We've done a lot with CBD. In fact, we were going to launch a CBD shot line, so liquid shots. But the input we got was, no, too much CBD, please. We're not going to be able to sell it right now. So, and then fermented mushroom, if we come across new, different mushrooms, then yes, we will look at those. So obviously anxiety is a big concern, mood. This is all areas that CBD and the microbiome and mushrooms function in. So it's a well-versed question, Andy, and it's an area that we continue to research. This is a picture of Blood Lake, just near Park City, and it's called Blood Lake. We hiked it a few Sundays ago, and I took this picture, and I learned why it's called Blood Lake, because there were mosquitoes everywhere, and they were attacking me. Had I known that, I would have mega-dosed on vitamin B1 or lathered myself with mosquito repellent. But beautiful lake. It had a rope swing at it. So if you come to Utah and you want to hike a beautiful 2-mile hike, this is a place to go. All right, David Clanton. I knew he would ask me this question. We've had these discussions before, and I wanted Dr. Barney's take on it as well. But it's around microdosing certain mushrooms called psilocybin mushrooms. Now, as a category, psilocybin mushrooms are illegal. They're not approved as dietary supplements, just as CBD wasn't, and until the Farm Bill passed. So there is some legislation in Oregon to try to pass some of these microdosing of what's called magical mushrooms. It's a category of mushrooms. They were used anciently in rituals, but very effective for people suffering from anxiety, PTSD. So we're looking at the legalization of it. David, if we launch it, I'm going to name it after you somehow. We'll figure out a way to do that. But I would love to be first to market, but we also have a legal obligation, and we need to protect our company. This is a giant sawtooth mushroom I picked in Park City at the Swanner Nature Preserve when we were out knocking down some noxious weeds. Dr. Barney, do you have any other thoughts on psilocybin mushrooms?
Well, I guess my only thought, although I didn't know that Oregon already had legislation, my thought is that if this follows sort of the same path as cannabis, it's going to take a long time. But I think maybe the fact that cannabis, is now legal in many states, that the path for psilocybin may be shortened and not as tortuous. It can be very useful for certain conditions. Psychosis, there are a number of things that it can be useful for, given the right dose and circumstance. But it's one of those things that I think, at least for the near future, needs to be dosed at an appropriate dose under controlled conditions, because at this time I don't know you can predict what a person's side effect or what the effect is going to be and how they're going to handle it. So that's it.
Very good. Diane Keller, she reps in a bunch of states, but I put Hawaii there because I wanted to go there mentally when I was putting this together, as we all would. She asked, does CBD and THC applied topically enter the bloodstream? Now, the cannabinoids are fat-soluble, and therefore, by nature, just like a vitamin D or a vitamin A retinol, they will be able to penetrate and be absorbed topically. So that's why we've recently launched them as the fast-absorbing relief gels and Solaray. And Paul Benty asked a great question yesterday to me. I don't know if he's on, but how much melatonin is in the sleep blend? And because it's not listed on the label, and it's 1 milligram of melatonin per dose. So now you all know. Dr. Barney, any other thoughts on topically applied cannabinoids?
I don't.
Okay. Perfect. And again, this is a picture of our tour when Patricia, Miranda, and myself went toward the Applegate Valley of Southern Oregon, where these beautiful organic hemp fields are grown by a small family, organically grown. Okay, this is Lydia Ellsworth in Arizona. What new supplement research are you most excited about? Dr. Barney answered some of these from his point of view. She asked, what types of products do you think will see the most new customer demand for, especially customers who haven't typically shopped for supplements? So obviously we've seen a huge surgence of people entering health food and supplements in general, up to 30% increase, which is dramatic because of COVID. So as they go into health food, a lot of the early on, and I'm talking end of March, right now we've noticed that people have kind of slowed down going into the health food stores and they're ordering more online just to avoid exposure. That's typically the trends we've been seeing. But for those that have gone into health food, that's been the opportunity for these retailers to capture them and to say, oh, what else are you taking? You know, are you taking your daily multivitamin or your digestive enzymes, or what are you struggling with that we can help answer? And so the more we can get people into those health food stores, obviously the better it will be for them and for us. But in terms of new research that excites us the most, lately, personally, I've been digging into not just the microbiome, but in liposomal research. And there's a company in Colorado specifically that's getting some patents on not just liposomal vitamin C, but other fat and water-soluble vitamins and minerals that are being microencapsulated in that polar, non-polar mice cell that you can create with a lipospheric structure. And that basically allows that vitamin to pass safely through the digestive process and connect with the body's cells and release those actives directly into the cell. So we're seeing in the early research much higher absorption. The term liposomal has been defined in many different ways. It can mean just fat-soluble, but most recently it represents this lipospheric molecule that has these phospholipid heads and tails that can encompass water-soluble vitamins and fat-soluble and minerals. And they use this to deliver drugs to the cells in the 60s. That's when the liposomes were invented. And they're still early to market. Michelle Patterson, who's also on the call, will remember in about 1999-2000, we attempted to launch a line of liposomal vitamins. They were liquid sprays and cal, and it was really early to the market, and they didn't do very well. That happens often. We're sometimes early to market with concepts, and people just aren't ready. Anything else you want to add, Dr. Barney? I didn't want to spend too much time on this, but research that excites you?
Well, no, I've talked about the microbiome research and some of the research concerning supplements that can help, antibiotics do a better job, those kind of things, but nothing else.
Yeah. I'm holding this book up. This was just a few weekends ago here in Midway at this beautiful little lake. And Suzanne Summers is a celebrity I've been following just because she brings to light a lot of new research. And in this book, she talks about telomere length and promotes a specific supplement. Rachel and I have looked into that research, and there's not a lot to it, but there are people asking for telomerase or telomere lengthening products. The telomeres, Dr. Barney, I really didn't prep you for this, but can you explain what those are?
Only that they're the very end of a gene, and that they have a significant effect and seems to have more of an effect on longevity, health, longevity. I've not been very impressed with research that says there are things we can take that will make a much difference at all.
Yeah. The theory is over time, as those DNA strands break apart and there's genetic expression happening, that those telomeres get shorter and shorter. And as they shorten, that's not favorable to our health. And so we want to keep them long. And so I've seen herbs like astragalus being promoted primarily to help lengthen them. But again, it's really good marketing. It's a good story, but there's not much to it from what we've been able to read. Okay. Miranda in Oregon. She's our own little mycologist. She could probably talk more about mushrooms than any of us here. But during your time studying probiotics and the microbiome, what stands out to you as the most surprising function that you have learned a probiotic strain possesses? Dr. Barney, any thoughts on that?
Boy, a specific strain. Now, see, if I pronounce this wrong, then you may have to get her on. Akkermansia eosinophilia, which shows that as that particular bacteria goes up in the microbiome, the BMI goes down. So if you're looking at, our troubles as a society with overweight, this is one that may have a significant benefit for that particular problem, and therefore benefit to heart disease, a benefit to diabetes, a benefit to a lot of things if we can truly get weight to go down, a BMI to go down. Now that's one of the last ones that I was really, looking at. There really are so many that, heart disease goes up when certain bacteria go down. Is amazing, and I think that to me is the area of research that excites me the most, is the microbiome and what kind of things we can do to improve health through it.
Yeah. This is a picture of Dr. Kelman and Rennie, his business manager, when they visited our facility in Ogden. And next to it is a picture of Viome. It's a home kit test that you can order and provide samples, and they test your microbiome. I recently acquired this, and I submitted samples, and I downloaded the app and answered all the questions, and I was shown to have a very diverse microbiome, which was pleasant to see. And so I'm going to see what other recommendations they have. But you can order kits. You can get your microbiome tested. In terms of function, we didn't really talk about bone strengthening with bacteria or specific mood altering or cardiovascular benefits with bacteria. Now the world is really opening up with this microbiome medicine notion, and Dr. Barney is on top of it and continuously researches it, and we have Dr. Kelman in New York that provides a lot of input in this field as well. So, now, this is a question from the Inside Sales team, and we just have a few minutes left, so I'll try to finish these last three quickly. When an SP blend is discontinued, is it due to bad sales or not being able to have access to a raw material like Solare SP3 Respiration Blend and Pleurisy Root? It seems like many SP blends are being discontinued. We have discontinued a few of them, and we've also reformulated a few of them. Usually it's not due to lack of sales. These generally do well across the country. Yes, Pleurisy Root is a once-a-year crop. It comes out of Maine primarily. And when the tundra and the snow melt and the ice goes away, you'll find it, and that's when you have to harvest it. But it's a rather small window. And so we've created some pretty complex blends, and some of them rely on some tricky herbs, and so we've either had to change them up or, discontinue the product. But we still have a solid offering in the SP blends, and they're timeless, and they're tied to Dr. Barney's book, The Clinical Applications of Herbal Medicine, that Jennifer mentioned at the beginning of the call. Every blend and every number corresponds to a chapter of that book. So if you ever run across a blend like SP3 and you want to know more about how it works, contact me or Jennifer, and we can send you a scan of the chapter of that book where Dr. Barney explains the benefit of those herbs. This is a picture I took this summer. We had a COVID escape to beautiful Capitol Reef in southern Utah. And this is just a wild daisy that was growing there, and there wasn't much else growing but this, and another purple shrub that looks like an astragalus, which I'll show. Oh, no, I didn't put that down. But anyway, I thought this was a beautiful sign of nature coming through the arid desert floor. Another question, the fertility blend SP1, which is now the hormone blend SP1, used to not state take for longer than a week, and most women would use it during the week of ovulation. Now it states only not for long-term use. Is this product for men and women, and why did we change the instruction? Dr. Barney and I actually talked about this change, and we agreed on the new name, Hormone Blend. This was purely a legal recommendation. The formula didn't change. The directions or the nothing changed. It was always as represented here, to not take for long-term use, but it never specified a week or anything like that. So we want to understand how some of these herbs work on hormones. And Dr. Barney, I don't know if you want to add anything else to that. I kind of mumbled through it, but the formula hasn't changed. It just went from fertility to hormone.
Right. It really uses, for the most part, mild herbs that have a very nutritive effect, and to use them for a long term, there would be nothing wrong with that. There's nothing there that you couldn't use sort of forever. I think anytime you're talking about hormones, then the legal people get a little concerned, but that's it. I think it could be used for pretty much any period of time.
Yeah. You'll notice on the front panel we changed it at the bottom left where it said with homeopathic nutrients. Now we say with cell salt nutrients. We had to remove the word homeopathic from the front since this is not made in a homeopathic facility, but it's the same cell salt. And there's a book written on cell salts and the importance of using those regularly. So let me get to the last question, and we're right on the hour. With so many different products within Solaray, why don't we come up with some immune system support plans for children and adults? Should everyone be taking immune support products and multivitamins to help the immune system for COVID-19? That's a timely question because this fall, late fall, we're going to be launching a line in Solaray called ImmuFight, and it's a lineup of both shield and combat products. We really don't talk about COVID for obvious reasons, but some are targeted for colds and others are targeted for viruses, and another one is targeted for respiration health. And I think you'll be impressed when you see the lineup. We're just running the pills now through final stages of the test run, I believe. Rachel's on top of this. She helped formulate them, and we're really excited to get these to the market. I'm a strong believer in taking a multivitamin daily just to cover your bases. And this is a picture of our One Daily Woman in Goblin Valley in southern Utah. And I take the One Daily Active Man every day. I just feel it covers my bases, and when I don't, I definitely feel a difference in my energy. And so, Dr. Barney, any final thoughts on multivitamins? Is this a waste of money? Should people be even taking them? What do you think?
Well, I think generally taking a multivitamin is a good thing, and that most people should be taking them, and especially during the fall, winter months. Just a reminder as far as UMCA. UMCA is one of the few things that can truly treat a bronchitis. Bronchitises are almost always viral. Antibiotics don't do any good, although a lot of doctors are sort of pressured into prescribing them by their patients. Research done, and I don't remember if it was Minnesota, if it was Wisconsin, one of the medical schools back there about 10 years ago, probably 12 years ago, did research on UMCA and found that it shortened the course, and one of the few things that can truly treat a bronchitis. So keep that in mind as we're heading into the fall and into viral infection time.
And we have UMCA available in Zand. It's called Zumca. We have it in a syrup. We have it in a PM formula. We have it, I think, with even elderberry. And then we have it in the lozenges. So I'm glad you mentioned that. Dr. Barney. Okay, I'm going to quickly go down. Since we have him, I want to answer people's questions in the chat. A few came up. So if you have other questions, put them in the chat. And I know Rachel's been answering a few along the way, so I appreciate her. Really quickly, Dr. Barney, this is Judy Homer, who's over distribution sales. With berberine, which we know you love and know about well, can you replace metformin? If a patient comes to you and they're on metformin, can you wean them into berberine instead of metformin?
I would hesitate to do that for most folks. If you had somebody who really was good at following up and you could track their blood sugars, it's a possibility. But I would hesitate to do it unless somebody is really conscientious and is willing to follow their blood sugars over the next 3 months to make sure that they stay stable.
Okay, wonderful. Rosalind Rogers, Dr. Barney asks, what are your thoughts on lobelia for lung health?
It's one of those that I haven't used much, just because of, I guess, potential toxicity early on when I was learning about herbs. It was one that came up. However, I do keep some in my cupboard and would use it if I get a lung condition that involved asthma kind of symptoms with some wheezing and cough and all that. I would use it. So it's not something I recommend commonly, but it's something that I do think is in the armamentarium and should be considered when somebody is sick and not responding.
Okay. Excellent. Somebody else asked, what is your recommendation for individuals taking prescription medication for anxiety, depression? They specifically mentioned Celexa, to reduce, eliminate dosage, and replace with herbs, minerals. Have you seen anything for anxiety and depression specifically? I know this is a big question, and it's very subjective, but thoughts on that?
Well, I just actually, in preparation for this, was looking at some research, and lavender came up, and again, a little bit higher dose, concentrated dose of lavender was found to be very useful for a variety of anxiety conditions, not just sleep, but anxiety in general. And the recommendation actually was to use the oil and take it. Now, I've actually taken some rosemary oil and some a couple of different oils in warm water, and it's sort of tough because they get very aromatic right away, assault your nose. But anyway, using a couple of drops of lavender oil is what was recommended for people with severe anxiety. I think some of the adaptogens like ashwagandha can be very good for anxiety. Works more slowly than lavender, which can work almost like an anti-anxiety medication. You take a pill, and an hour later you feel improved. Again, I hesitate to switch people over unless I can follow them regularly as far as their anxiety symptoms and that. And then the problem is not knowing which herbs per se may have a untoward effect in combination with some prescriptions, and to give them at the same time. In other words, to try to get people off Celexa or something else.
Yeah. Carol, the strain that Dr. Barney mentioned for weight management is not commercially available, so if it is, we could look at that. But it's naturally inherent in our bodies, and they did a study, a friend of mine who's the head of the microbiology department at BYU, she did a sabbatical in China where they fed an obese man a lot of prebiotic fibers, and his level of that Akkermansia, I think that's how you pronounce it, went up in his body. And so he lost 120 pounds in a matter of a few months. It was quite dramatic, just by switching to a diet of high fiber prebiotic foods. So eating the right prebiotics is probably the most important thing we can do for our microbiome. So apples, bananas, carrots, artichokes, jicamas, beets, these wonderful vegetables and fruits are critical to be snacking on and be taking on a regular basis. Janet asked
Max,
if we have a replacement. Oh, go ahead.
well, I've got to go. I've got 3 patients
Okay.
waiting here, so
Thank you,
I'm
Dr.
going to
Barney.
run. It's been a privilege, and I appreciate being with you.
We appreciate all you do, Dr. Barney. Take care, and we'll be in touch soon. Thank you.
Okay. All right. Bye-bye.
I'm going to go ahead and answer a few more of these questions for you guys that want to hang on. If you have to go, I understand. Do we have a replacement for SP3? That's the respiration blend. When pleurisy root was unavailable and it was out of stock, we really didn't have a specific replacement. We have other respiration products, but you can always look at those herbs and combine them with things like lobelia and bromelain and quercetin and such for respiration health. There's also probiotics in the urgent care. The Paracasei strain is really good for respiration health. And I'm not aware of it being discontinued, Teresa. So let me check with Team Solare. They may have it on a hold status if they're not able to source the pleurisy root again, but I haven't heard that. We will, Carol, on multivitamins, continue to update them and add in methylated Bs. We've done that with the adult 50 plus. If you look at it, we use methylcobalamin. We will, as I'll recommend to the brands, to always use the methylated forms of the B vitamins because we know that they work quicker that way. Okay, well, folks, that's it. Thanks for hanging on with us. It's been a pleasure. Jennifer, if you want to end the recording,